Protecting children takes more than one person or one agency. It takes a coordinated statewide effort. As a part of that effort, Missouri's medical response is led by the Safe Care Network. Safe Care is a statewide network of specially trained medical providers and child abuse medical resource centers working together to deliver expert evaluation, training, and support. The Missouri Department of Health and Senior Services funds Safe Care through a partnership with the Missouri Network Against Child Abuse, supporting a coordinated system of care across the state. Our goal is simple but critical: to make sure every child receives the medical evaluation, care, and follow-up they need to support their health, safety, and future. Safe Care is built on collaboration, working closely with child advocacy centers, law enforcement, children's division, and other partners, ensuring every child's case is considered with a multidisciplinary team. Just as important, the Safe Care Network supports providers through ongoing training, mentoring, and peer review, strengthening both individual practice and the overall system of care. This coordination is especially important for our youngest children. Under Missouri law, when a report of suspected abuse or neglect involves a child under the age of 3, a Safe Care provider is required to review the case and evaluate the child. That means Safe Care expertise is part of the response from the very beginning. Through training, collaboration, and coordinated review, the Safe Care Network strengthens Missouri's response so children are not only protected but truly supported.
I became a child abuse pediatrician because when there are allegations or concerns about abuse of a child, it is one of the most challenging situations faced by physicians and the child and the family that you can imagine. And it's important to have someone to advocate for children in these situations because children are the most vulnerable people in our society. So the best way we can advocate for children is to do our work carefully. And children don't have anyone to speak for them in many of these situations. And so often that is our role. The value of Safe Care is that it allows children and families in situations where they may have been abused to access providers across the state who have been trained in these evaluations. And Safe Care provides the training and the support for providers all around the state to do the right thing in these situations.
Being a Safe Care provider means committing to the careful, compassionate evaluation of children who need specialized care. It means working closely with child advocacy centers, law enforcement, social services, and other partners who share responsibility for child protection. Every child with concerns for abuse or neglect deserves timely access to a trained Safe Care provider. That access can change the trajectory of a child's life.
During my medical education, I realized that children and their families would benefit from pediatricians knowing more about child abuse. The Safe Care Network has provided a lot of education and guidance to healthcare professionals around the state. Those providers have helped to identify children and families in need of assistance.
To become a Safe Care provider, clinicians go through 2 days of intensive training regarding child maltreatment. The foundational training consists of 1 day of physical abuse and neglect and 1 day of sexual abuse. The value of the foundational training is it sets a baseline that all Safe Care providers must meet, and it provides the foundation for further learning as they proceed in this work. Clinicians gain baseline skills as far as factual information, but they also do a lot of interactive work and question answer in this training so that everybody gets the same baseline facts that they learn, but then individual Safe Care providers can explore their own needs and their own strengths and weaknesses and discuss with other Safe Care providers and with mentors to close the gaps in their own knowledge and explore the challenges that they'll face in this work. The annual update training is a 1-day intensive training that provides new literature and new science, closes gaps that are seen in the Safe Care system. It allows Safe Care providers around the state to stay current in the new literature and to continue to grow as they work in this field.
Clinicians enter the Safe Care Network with strong medical backgrounds. However, they often do not have sufficient experience in child maltreatment and may need additional support with complex cases. Safe Care helps providers navigate complex cases by connecting them to more experienced providers who can offer education, guidance, and support. Monthly webinars create a consistent space for learning and discussion. These sessions help providers stay connected and maintain their safe care status. Accurate identification of accidental and abusive injuries is crucial for a child's safety and their family's well-being. The ultimate goal of working with children through the Safe Care Network is to ensure every child we encounter is safer after our involvement than they were before.
I'll never forget a young child I evaluated who insisted on sitting with her mother while I explained my findings of her evaluation. When I finished, she turned to her mom and whispered, "She believes me." In that moment, I understood the heart of this work. Every child deserves to feel heard, respected, and supported. If a child leaves feeling believed and safer, then we've done our job.
For 20 years, the collaboration between the Department of Health and Senior Services, Missouri Network Against Child Abuse, and our statewide partners has strengthened the medical response to child maltreatment in remarkable ways. Safe Care created a network of providers in Missouri, expanding the availability of comprehensive, state-of-the-art medical care to alleged child victims in their own communities. Safe Care providers help put children on a path to healing. At MO-NACA, improving the medical response to child maltreatment in Missouri is a privilege. We are deeply grateful to our Safe Care providers in the network, to the Child Abuse Medical Resource Centers, and to the many partners across the state who are committed to doing what is best for children. The need for the network and the value of the services continue. I'm confident that 20 years from now, we will look back at our efforts knowing we strengthened our system to advance justice and healing and changed countless children's lives.